Welcome to CHRISTUS St. Michael, and we're delighted that you've selected the CHRISTUS St. Michael Joint Replacement Center for your surgery. We ask that you watch this video in its entirety. If not all today, come back to it because it will have important information about your surgery, your stay here at CHRISTUS St. Michael, and your recovery. We also want to know what we can do to help you, so please let us know if there's anything you need during your stay here at CHRISTUS St. Michael. Again, thank you for selecting CHRISTUS St. Michael, and we hope you have a speedy recovery. Many blessings to you.
Your pre-admission process will help prepare you for your scheduled surgical procedure. During pre-admission, you will have lab tests, x-rays, and an EKG done, if not already done by your primary care physician. One of the pre-admission registered nurses will speak with you about your medical history and medications, so please bring your current medications to your pre-admissions appointment. Your surgical consent form will be discussed with you and signed at this time. During your appointment, one of the registrars will ask demographic information like your address, phone number, insurance information, and financial arrangements. The easiest directions to the pre-admissions area is to turn right into the second entrance to CHRISTUS St. Michael. You will see a sign noting Cancer Center Pre-Admission Center. It is on the first floor. Expect to be in the pre-admission area for approximately 2 hours. Your surgeon's office nurse will instruct you what time to arrive at the hospital on the day your surgery is scheduled. To get to the main lobby of the hospital, turn right in the first entrance to CHRISTUS St. Michael Hospital. You will come to a stop sign and see the main entrance of the hospital. Your ride may drive you directly to the main entrance, where you may wait in the lobby. There are handicap parking sites near the main entrance and also wheelchairs if needed. Once in the main lobby, take the elevators to the third floor landing. You will see a desk to check in for your surgery, and we will be expecting you. Your family member will be given a pager to keep in close contact during your time in surgery. They will be paged when surgery begins, when surgery is completed and the surgeon is ready to speak with them, and when you are taken to your 3 South room from recovery. Once you have checked in at the desk, you and a friend or family member will be escorted to one of the ambulatory care rooms. There, you will be prepared for your surgical procedure. Our specially trained nursing staff will guide and assist you each step of the way. You will be asked to brush your teeth and use mouthwash. This helps prevent pneumonia. By reducing the amount of bacteria in your mouth, less bacteria can get into your lungs. Before changing into your hospital gown, you will be assisted with wiping off with warm antibacterial towelettes to help rid the skin of bacteria and prevent infection. Your surgeon may order tight-fitting compression stockings. You will have compression devices for your feet, circulation, and prevent blood clot formation. Ankle pumps will help prevent blood clot formation. Do 20 to 30 ankle pumps every hour. If you have compression stockings ordered, they should be worn daily until you return to the surgeon's office following your hospital discharge. Then follow his direction of how long to continue the stocking use. A nurse will start your IV. Your surgeon will stop by to see you before surgery. You will meet the anesthesiologist, or CRNA, who will provide your anesthesia. Most often, anesthesia given during this type procedure is general anesthesia. This simply means you are put into a very deep state of sleep. You will be on a breathing machine or ventilator during the time of surgery and then brought out of that deep sleep at the end of surgery. Some patients experience a sore throat due to the small breathing tube used during the anesthesia. Most often, just having something to drink relieves the sore throat symptoms, but if it persists, let your nurse know. The surgery you have scheduled usually lasts about 1.5 to 2 hours. Your family and friends will be kept informed as they wait in the large surgery waiting area. There are coffee, vending machines, as well as restrooms nearby. As soon as your surgery is completed, your surgeon will have your family paged and speak with them. When your surgery is complete, you will be placed on your hospital bed and taken to the recovery room. Your time in recovery is usually about 1 hour. There, the nurses will monitor your breathing, blood pressure, and heart rate, among other things. You will be asked to describe your level of pain using our pain scale, 0 meaning no pain, through 10 meaning the worst pain possible. We cannot make all the pain go away. Our goal is to get your pain to a tolerable level, to a point where you can eat, sleep, and move around. Our recovery room nurses will treat your pain by giving pain medication through your IV. It works quickly. Most often, your surgeon will order a pain pump called a PCA, which stands for Patient Controlled Analgesia. The nurses in recovery will follow your surgeon's orders in programming your pump so that it is ready for your use when you arrive in your room. Use the dose button as often as you need pain medication. This type of pain medication works quickly, but the effects do not last a long time. You will have to push the pain dose button when the pain begins to return. This type of strong pain medication can slow the breathing rate, so an oxygen sensor will be placed on a finger or a special oxygen tubing placed in your nose to monitor your oxygen level during the use of this type pain medication. The pain pump will be discontinued the morning after surgery, but don't worry, you will have other medication for pain that will last longer than the PCA dose generally lasts. Oral medication will already be ordered. You must request oral pain pills. They are not brought on a schedule. It will generally take about 15 to 20 minutes for you to receive the medication after requests are made. So ask for the medication when your discomfort begins to increase. If you have not received medication within 30 minutes of your request, please call again. Most often, oral pain medication is prescribed every 4 hours as needed. Oral pain medication can cause nausea if taken on an empty stomach, so be sure to eat or have food in your stomach when taking pain medication by mouth. Oral medication is also slower to take effect than IV medications. It can take 30 to 45 minutes after swallowing medication before you feel the pain relief. You also will have ice packs on the area of your incision to help with pain and swelling. Also, for knee replacement patients, your surgeon may ask anesthesia to inject numbing medication into the leg above your knee to help control pain after surgery. This is called a nerve block, and the effects can last for up to 24 hours. A side effect for some patients is leg weakness, which also can last up to 24 hours. If your leg is weak due to the nerve block, a leg brace will be used that day for walking. Both IV and oral narcotic pain medications cause constipation. Avoid constipation by increasing fiber and fluids in your diet, such as raw fruits and vegetables, fruit juices, and whole grains. An over-the-counter stool softener or laxative may be needed at home during your recovery while you are taking pain medication. Make sure your bowels move at least the day before your scheduled surgery. If your pain is not tolerable or you have any questions, please ask the nurse. Remember, we cannot make all your pain go away, but our goal is to manage your pain to a level where you can eat, sleep, and move around, and do it safely. After your surgery and time in the recovery room, you will be taken to your assigned 3 South Joint Center room. There, your family can join you. You will be checked on frequently. It is important to take deep breaths and cough every hour while you are awake and any time you are awake throughout the night. A breathing exercise device called an incentive spirometer will be given to you, and you will be instructed by the nurse how to use it. Brushing your teeth and using mouthwash, along with the use of the incentive spirometer and getting out of bed, will help prevent pneumonia. All the patient rooms at St. Michael are private rooms equipped with a bathroom, shower, small refrigerator, a sleep chair, and a special recliner for you. Your coach is welcome to stay with you and will be provided with a blanket and pillow if they choose to stay. Your special recliner is designed especially for surgery patients. It is higher than a normal recliner. Early the morning after surgery, you will be assisted with a sponge bath to get dressed in your own clothes and to get into the special recliner. You will stay in the recliner from before breakfast until after supper. You will do your physical therapy exercises in the recliner. When you walk, someone will roll your recliner along behind you so you may sit when you feel the need to. Rest with your legs up whenever opportunity allows. Therapy will begin the day of surgery and then twice daily on the weekdays. While you are in the hospital, you will have group therapy morning and afternoon. Your physical therapist will complete an evaluation the morning after your surgery. Your ability to get in and out of bed and the chair will also be evaluated. Evaluation will include assessment of your strength and range of motion. You will be shown how to walk using the appropriate assistive device with the goal of increasing distance as much as you can tolerate. You will also work on climbing up and down the stairs if needed, and instructions will be provided with getting in and out of the car. Part of your recovery will depend on how quickly you regain muscle strength. Group exercises will begin in the afternoon on the day after surgery. It is important that you participate in group session to ensure that you do all of the recommended exercises correctly. You will be encouraged to do 2 sets of 15 repetitions of all exercises twice a day. All total joint replacement patients gather at the training room along with the physical therapist and your coach. Your coach will help you understand and safely perform all the exercises under the guidance of the therapist while you are in the hospital and at home. Copies of all exercise illustrations are found in the guidebook for future reference. An ice pack will be provided during group therapy to help decrease the pain and swelling. It will typically be wrapped around the affected joint and left for about 10 to 15 minutes. You will be encouraged to use the ice pack as often as necessary during your stay and at home. Your occupational therapist will complete an evaluation the morning after your surgery. Your ability to get in and out of the chair to the bedside commode will be evaluated at that time. The evaluation will also include assessment of your upper body range of motion and strength, your ability to perform self-care, and any medical equipment you may need at home. For those of you receiving a total hip replacement, you will be shown how to observe hip precautions while using the rolling walker, positioning yourself in bed, getting in and out of a tub or a shower, as well as a vehicle. Following these simple precautions will prevent your new hip from dislocating. You will be educated on how to protect your hip from dislocating while performing laundry tasks or retrieving food items from the refrigerator by using long-handled devices. You will follow these total hip precautions for approximately 3 months or the recommendations provided to you by your orthopedic surgeon. You will practice using a reacher or dressing stick to take your pants off and on. You will learn how to use a sock aid to put on socks, and you will be educated on how to put on shoes with the use of a long shoe horn. You'll be taught on safety precautions in the home, such as good lighting, floor hazards, and safety with pets. Your therapist will also educate you on any other adaptive equipment needs at that time. Your safety is very important to us. Because of your surgery, equipment, floor surfaces, and other differences from your normal home setting, you will be considered a high risk for falls. Initially, only the nurses and therapists are allowed to assist you out of bed and to walk. As your ability to transfer and ambulate improves, your coach will be allowed to assist you. Always call for assistance with any need. Never get out of the bed, off the bedside commode, or out of your recliner without assistance. Our nurses and therapists are there for your care, so please allow them to assist you. Don't risk injuring yourself. Remember, call, don't fall. You and your surgeon, along with your nurses and therapists, will discuss your discharge needs to find the best option for you. A case manager will stop by your room to help make arrangements for any home equipment needs, like a walker or bedside commode, and any outpatient or home health physical therapy arrangements you may need as well. The majority of patients are discharged to their home with continuing therapy provided by home health or an outpatient facility. Outpatient physical therapy requires you to go from your home to therapy with someone driving you, usually 3 times a week for a length of time ordered by your surgeon, usually several weeks. Home health can be provided for those who have difficulty going from their home to therapy. The physical therapist will come to your home about 3 times a week for a length of time ordered by your surgeon. As you improve and it is not as difficult to leave your home, you may wish to change to outpatient therapy. Your surgeon's office can make those arrangements. Inpatient rehab may be needed for some patients. A rehab consult will be ordered if your surgeon feels inpatient rehab is best for you. You will be evaluated for certain requirements of rehab and your insurance contacted for approval. Those discharged to an inpatient rehab will be transported from their hospital room to the rehab by transport van. The length of time in an inpatient rehab varies according to the patient's progress and insurance benefits. The average length of stay in CHRISTUS St. Michael Center for Joint Replacement is about 2 to 3 days. When you are medically stable, you will be released, usually after the morning group exercise session around noon. As you prepare for your surgery, it is important for you to know possible complications and how to prevent them. Blood clots are possible after any surgery. By wearing the stockings and compression devices beginning just prior to surgery, doing ankle pumps, walking soon after surgery, and having anticoagulants or blood thinners after surgery, your risk of developing a blood clot is decreased. Infection is another risk of surgery. You need to know how to prevent infection. You will receive a small bottle of chlorhexidine from the pre-admission nurse. You should begin showering with this antibacterial solution daily, beginning 3 days before your surgery. The morning of surgery, shower with this solution once more. Follow the bottle instructions. Do not wash your face with this solution, as it can be irritating. After being released from the hospital, you should begin using liquid antibacterial soap, like Liquid Dial. By washing daily with the liquid antibacterial soap, not bar soap, you will reduce your risk of infection. Wash your hands often or use an alcohol hand cleanser. Insist that anyone checking your incision or changing your dressing always wash their hands first. Keep your incision covered. Do not rub, scratch, or touch your incision. You will receive instructions about how to change your bandage and when you may get your incision wet. Do not allow pets to be near your incision. In the future, inform your dentist that you have had joint replacement surgery. He will likely have you take an antibiotic before the dental appointment or procedure to prevent joint infection. Inform any healthcare provider that will be performing invasive procedures about your new joint. As you prepare for your hospital stay, pack for about 3 days. You should plan on bringing comfortable walking shoes, no flip-flops or boots. Loose-fitting, elastic waist, gym shorts work best, and comfortable shirts or tops. A light jacket or sweater, pajamas, and any personal care items you may want. If you use a CPAP machine at home, please bring yours, as it will have your settings and a mask that you are used to. If you already have a walker, you may bring it, but be sure to put your name on it. We will have walkers for you to use while in the hospital if needed. Bring your current home medications. You can prepare your home now, before surgery, for your return by doing a few simple things. Since you will be using a walker for a short time, make sure a walker will fit in the areas you will need to go, like beside your bed, through the living and dining kitchen areas, and bathroom. Most walkers are about 28 to 30 inches wide. Sometimes furniture is too close to allow a walker to pass, so you may need to make adjustments. Remove any throw rugs or area rugs or anything that can cause you to trip and fall. Choose a chair that has arms. If your chair is low, try adding a cushion or folded quilt to raise the seat level. This will help you to stand up easier during your recovery period until you regain leg strength. A good rule of thumb is the seat of your chair should be about the same level or higher than the bend of your knee. Chairs that rock, roll, or swivel are not good choices. You will not need a hospital bed for your home. Your regular bed will work unless it is very low, which would cause problems standing from a low surface. Do put clean sheets on your bed before coming to the hospital for your surgery. This will help reduce your risk of infection. Safeguard your bathroom. Safety grab bars around the bathtub shower are very helpful, as well as non-slip decals on the floor of your tub. You may find a shower chair or shower bench with adjustable legs helpful. Even a handheld shower head can be useful. If your toilet is low, a commode extender or a bedside commode will help you stand up easier until you regain your leg strength. Simply extend the legs and place it over your bathroom commode. If you have stairs inside or out, a handrail is another safety feature to consider. Plan to ride in the front seat of your vehicle when you are released from the hospital. Have your driver push the seat as far back as possible and also recline the back of the seat. This will allow you more room to get into the vehicle without having to bend your leg as much. You should also practice getting into the vehicle. Pretend you have had your surgery and get into the vehicle by sitting on the seat, not stepping into the vehicle. Try to get in your vehicle without putting weight on the leg you are to have surgery on. Good luck with your surgery. We want you to have a great experience during your stay with us. Please let us know of any needs that you may have. If you have any questions, you may contact our joint replacement staff. Thank you for choosing CHRISTUS St. Michael Center for Joint Replacement.